Good afternoon, everyone. This week, we continue to see progress in the fight against COVID in both Ontario and Grey Bruce. Both new cases and positivity rates in Ontario continue to decline, while Grey Bruce had only 7 new cases in the last week. Currently, there are no active cases in the town of the Blue Mountains. Hospitalizations, patients in ICU and on ventilators, and most importantly, deaths in Ontario continue to decline. New variants circulating next door in Simcoe County are a cause for concern. Residents are strongly advised to avoid close contact with people from other regions where these new variants are circulating and to avoid travel to those areas unless absolutely necessary. Now is not the time to let down our guard and stop doing the things that have kept our community safe. The Grey Bruce Health Unit strongly discourages travel from region to region or zone to zone unless it is for essential needs such as travel for work, school, or for medical reasons. Recreational, non-medical, social, or leisure-related reasons for travel are not considered essential and are discouraged as per the provincial direction. The health unit asks residents of Grey Bruce to double down on their commitment to following all public health protocols. Personal service businesses such as barbers, hair salons, and spas are encouraged to consider the following recommendations. These aren't regulations, but just recommendations to assist in discouraging interregional travel. Please limit or avoid accepting appointments from those of outside our region, or delay booking appointments until interregional travel resumes. Minor, hockey, or other sports teams should limit play and practice to only teams within Grey and Bruce counties. Teams or leagues from the red control level or gray lockdown areas should not be playing with teams in Grey and Bruce counties. Municipalities and others should avoid providing facility rentals to teams from those areas that prohibit team sports. Team play should be limited to a league that contains no more than 50 players. The league may only play and practice with members of the same league. An association or league cannot expand to join another league for additional player practice if the resulting group has more than 50 players. Also, do not coach or play in more than one league. Limit time spent in change rooms. Use change rooms for changing only or arrive dressed for play. Do not use change rooms for socializing, sharing food or beverage, etc. Additional recommendations from the health unit for all residents are: stay at home if you have symptoms. If you get tested and your symptoms have resolved, you must isolate until you receive your results. Limit carpooling and socializing to those within your household. Wear a mask or face covering in a manner that covers your mouth and nose when in an indoor area. Maintain a 2-meter physical distance. Practice frequent hand hygiene by using an alcohol-based hand rub or washing your hands with soap and water, and avoid interregional travel except for essential needs. The vaccination program in Grey Bruce is picking up speed. Currently, the program is vaccinating frontline healthcare workers, first responders, and residents over 80. To identify those over 80 for vaccination, the Grey Bruce Health Unit is obtaining their contact information by 3 methods. First, they are working with family physicians to obtain their patient lists. Your health care provider will call you if you are over 80 and eligible to receive the vaccine. You cannot book an appointment by calling your healthcare provider. They will call you. Secondly, they are working with organizations providing home care to obtain their client lists. Again, you cannot book an appointment by calling these agencies. Public Health will call you. A 1-800 number for booking and a provincial online booking system will be made available on March 15th, 2021 for those not captured by the above 2 methods. These include people over 80 years of age without a family physician and those with a physician that is outside the Grey Bruce Health Unit. Clinics and other venues where the vaccine will be administered are being developed this week. No appointments are currently available. You will be contacted directly to book your appointment in the coming days or weeks. Appointments are not available by calling the health unit at this time. The Grey Bruce Health Unit has been working with different partners through its vaccine task force to identify immunization spaces and communities throughout Grey Bruce. Primary care and pharmacists in Grey Bruce have been contacted to identify practices that are willing to run mass immunization clinics and to determine space requirements. By cross-matching the above, the Grey Bruce Health Unit will be able to provide immunization clinics to all residents of Grey Bruce as close to their communities as possible. The Grey Bruce Health Unit staff will provide the clinics with a supply of vaccine, the registration of all patients, and receipts for proof of vaccination. Be assured that all eligible persons will be reached through these methods and through mainstream media, social media, and media releases, and various partnering communication networks. Please continue to watch local media for updates as the vaccine rolls out to the different priority populations. To stay up to date, please continue to visit the Public Health Unit website at COVID-19 Vaccines, Public Health Grey Bruce. Have a great weekend and stay safe.